and she was completely stiff, and she was white. Her eyes were wide open, and her mouth was wide open. I just didn't know what had happened to her. I called an ambulance, and I was terrified.
Within minutes, the paramedics arrive. They find the infant's vital signs normal, but Julie is completely frozen. Then, without warning, she snaps out of it.
Began to shake. Scared to death.
Seizure.
The CAT scan images don't reveal anything out of the ordinary.
They showed no abnormalities in her brain, no bleeds, no tumors. They told me that she had had a grand mal seizure.
Weeks later, there's another frightening incident.
I was getting ready for work again, and sure enough, she was having another seizure. The seizures were terrifying. I took Julie in to the pediatrician, and they told me that now this would be a diagnosis of pediatric epilepsy.
Pediatric epilepsy is a neurological disorder afflicting children, in which unusual electrical activity in the brain triggers grand mal seizures.
The doctors told me that some children just have seizures with no known cause. I was told that they would give her some medication that would help control the seizures. I had to give Julie 3 pills every morning and 3 pills every night. For 2 weeks, everything was great.
But just when she thinks she has things under control, Jean notices something wrong with one of Julie's eyes.
Her right eye was getting puffy and that the lid was swollen. My mother said she thought that maybe she was having some kind of an allergic reaction.
I agree. That's what I was going to say.
By the time I came home from work that night, her other eye
She's
was
allergic
swollen. She could
to
barely
her medicine for the
I
seizures.
checked her temperature, 101. She was very agitated. I called the pediatrician's office first thing in the morning and made an appointment to bring Julie in to be seen by the doctor. She looked inside her ear and she said she has something in her ear. It looks like a little fluid-filled blister, and it's probably an ear infection.
You cannot be
And
more
the
wrong.
fact that her eyes were swollen shut. She also said that she looked like she had conjunctivitis in both eyes, and so she prescribed an antibiotic for the ear infection, and she said to continue to give her her seizure medicine. I was upset that she was so sick. She told me she'll be doing much better in
I don't blame her
3 or
for
4 days.
being upset.
Within hours of bringing her daughter home, a shocking new symptom stops Jean dead in her tracks.
I looked down at Julie's shoulder, and there was about 3 blisters on the back of her shoulder. They were fluid-filled, and they were pretty big, like the size of a pencil eraser.
But following a
Poor
careful
thing.
exam, the doctor is confident she knows what's wrong with Julie.
In addition to having conjunctivitis and an ear infection, she now has chickenpox.
You need to get a new doctor.
The blisters forming on her body. This little red spot would go to a big fat splotch, and then it would raise up. They would go from the size of a nickel to quarter size.
I love
On her
Souther
arms,
James.
on her back, on her legs.
I came to visit in the hospital, changed almost overnight.
I
She
changed
was
the
so
game.
totally blistered. I was horrified.
I accidentally gave myself
I
extra
kept asking, is this normal for chickenpox?
beaker.
I've never seen chickenpox like this, and I was always told, yes, not to worry. She's going to get better. It's going to turn around. She'll be okay.
But Julie's blisters continue to multiply at a horrifying rate.
Now the blisters were starting to run together. Her whole face was now a giant mass.
That's Steven Johnson syndrome. I got Diner Dash.
Julie's blisters continue to multiply at a horrifying rate.
Now the blisters were starting to run together. Her whole face was now a giant mass.
I had never seen blisters that large in my life. She was unrecognizable.
She looked like someone had poured hot oil on her. She looked like she had been burned.
That they're having a drug reaction. Once you look carefully at the clinical findings, there really is almost nothing else that can do this. Julie was diagnosed with Stevens-Johnson syndrome.
Stevens-Johnson syndrome is an autoimmune disorder in which the body experiences a severe reaction to certain medications. In healthy individuals, white blood cells defend the body by attacking infections and foreign substances. But in patients like Julie, a medication reprograms the white blood cells to target the mucous membranes and skin. As the top layer of skin starts to die, blisters form.
Stevens-Johnson syndrome can be triggered by any number of medications. In Julie's case, the anticonvulsant was the trigger treatment. There's nothing that we know that stops the course of the disease. So once it gets going, it tends to run its course to completion.
The first thing the medical team must do is take Julie off the anticonvulsant medication.
There were some sedative-like medications that can suppress seizures, and then we need to provide the best supportive care possible and make sure that she was watched carefully for any signs of secondary infection.
I'll continue this game if I don't continue it.
Scarring is relatively
Like
unusual,
if I
but
run
one
out of
of the areas that
time.
can be quite devastating is on the eyes. And scarring on the eyes, particularly at the cornea, can result in permanent visual loss.
They told me that they were doing everything they could to try to save her eyes, but that they wouldn't know for a couple of months. I started crying. It was the most devastating thing to hear.
For the next 2 weeks, Julie is monitored 24 hours a day until finally she begins to turn the corner.
Good.
Her fever broke, and she was running a normal temperature. Nobody knows why, but apparently Stevens-Johnson syndrome, it had finished.
But the disease has taken its toll on Julie. The blisters have permanently damaged her eyes. She's blind in her right eye, and her left eye has low vision and an extreme sensitivity to light.
At least she's
But
alive.
as Julie slowly recovers over the next year, there is an unexpected and pleasant surprise.
Fortunately for Julie, she was cured of her epilepsy. The cause of Julie's seizures was unknown.
The last seizure she had, she was 15 months old.
Today, Julie is 16 years old and has no memory of the horrifying ordeals she and her mother endured.
Today, Julie is a teenager. She is a very normal, well-rounded teenage girl doing all the things that other teenage girls do.
My hopes for my future are that I could go to college and major in music. I want to have some sort of career in the music field. I'm not sure what.
I'll
yet,
finish
but
it next time
definitely
if
want
I
to
don't
sing.
finish.
She proved to
I'm talking about
us,
the game.
proved to us as a baby that
She's a fighter. She's made it this far, and she's going to keep going. She'll do everything she's ever wanted to do.
I think what makes me so strong is that I have all the support from my family, which really helps me. I would like to say thank you to my mom for fighting so hard for me, because if it wasn't for her fighting for me, I don't think I would have been here today.
Thank you for watching. I'll see you next time.